Hi, my name is Lance Lazatin, and I'm the pediatrician and owner of Lakeside Youth and Kids Pediatrics. And I'm here to talk about how to choose a pediatrician if you're an expectant parent. Why is it important? Well, unfortunately, with the whole social media, society has gotten a little bit more judgmental in terms of every decision that first time mothers make regarding rearing their children. So choose a pediatrician that's supposed to be on your side. When you go to the clinic, it should be a safe haven. You shouldn't go there and then get judged on, and it turns into a blame game of sorts. This relationship is sacred. Going to your pediatrician and whatever you talk about should stay within those four walls. And lastly, this is a relationship that should last at least 18 years. And that's why choosing a pediatrician is going to be very important. I think there are guidelines that you should follow when you are choosing one. So first one is choose a practice that suits you. Is it going to be a big practice or is it going to be a small practice? Remember, with bigger practices, you can get an appointment every single day or even the next 1 to 2 hours because they have more pediatricians there. The other thing is with a bigger practice, then there are more doctors and nurse practitioners where they can actually talk about the child's care or some complicated issues that maybe your child has. And lastly, with a bigger practice, they are going to be up to date in terms of following protocols and health guidelines. And the reason is, with a bigger practice, they tend to have more patients, so you might not see the same pediatrician or the same nurse practitioner every single time. So it just behooves them to follow protocols. That way, their care is going to be very uniformed and streamlined. Versus if you choose a smaller practice, then find out how easy it is to get an appointment. If, let's say, the pediatrician is out or he's on vacation or he gets sick, does he have a backup? With a smaller practice, they get to know your patients a little bit better. And sometimes, every child, unfortunately, is going to be different. Their normals are going to be different. And that's why with a smaller practice, because they know you better, they know Johnny a little bit more, sometimes they're able to think outside the box and be a little bit more creative in terms of problem solving. With a smaller practice, usually they don't have a third party triage or a nurse's line. If you call a small practice at 3 a.m, you are going to talk to the physician himself. The next thing that is probably going to be important in choosing a pediatrician or choosing a practice is find out if this pediatrician, if he or she is board certified or not. In the United States, you do not have to be board certified to practice pediatrics, but it's always good to have a board certified caregiver because that tells you that throughout the pediatrician's career, he's painstakingly taken steps to keep his knowledge and skills up to date with the current health standards. Another thing that is going to be important in choosing a pediatrician or a pediatrics practice is, find out what their practice philosophy is. Are they someone who is more naturopathic or homeopathic versus somebody who's a little bit more Western medicine trained? Because at the end of the day, you should come up with solutions that are comfortable, or you come up with a plan that you are comfortable with, that the pediatrician and yourself have come up with and agreed upon. Find out if they vaccinate, how much of their patients are vaccinated, find out if they have special guidelines or special schedules that they follow, or find out if they take patients who are unvaccinated. The next one is probably antibiotic use. Find out if they're a little bit more liberal in prescribing antibiotics versus, a pediatrician who's a little bit more stingy and would tell you to hold on, try to run through the illness course and tell you what to expect. 90% of the time when children are sick, it's going to be a viral infection. So I tell my patients 90% of the time, I'm going to be holding your hand and telling you not to jump off the cliff yet. It's going to be better. And then the third or fourth day, you're going to develop a rash and you're going to tear your hair out. But after that, then everything's going to be fine. So choose a pediatrician that you're going to be really comfortable with. And then finally, find out what the pediatrician or what they do outside the clinic. Find out if they have children, find out what their hobbies are. That way, that makes them a little bit more human, and that gives you depth and perception into how they make about these decisions that you guys come up with together. And once you have something to go on in terms of similarities and interests, then the visits are going to be a little bit smoother and not very cold. I think following these guidelines, you'll be able to find a pediatrician who aligns well with what you believe in, and it's going to be a little bit more comfortable bringing your children to him or her. Thanks.